Welcome to Board Certified, expert interview episodes about medical licensing exams and healthcare careers. I'm Tyler, founder of Achievable, and we offer affordable adaptive online prep courses for the USMLE Step 1, MCAT, PTCE, NPTE, and others. Each course contains everything you need to succeed, including comprehensive study guides, video lessons, thousands of practice questions powered by our memory enhancing algorithm, and full length practice exams. You can get a free trial of any course by going to achievable.me. And if you like it, be sure to use the code podcast to save 10%. Now, let's get started. Today, I wanted to introduce Immanuel Olarinde. And Emmanuel, I'd love if you could introduce yourself and your background.
All right, thank you, Tyler. My name is Immanuel Olarinde. I am from Nigeria. I was raised and born here. I went to a Caribbean medical school and I started tutoring USMLE examinations in medical school since 2018. Since then, I would say I've had maybe over 20,000 hours of tutorials or advising students on the examination. I've written the exam myself, step one, step two, CK, and I look forward to really talking about it today.
Yeah, so let's just talk about the USMLE as a whole. This is the test to become a medical doctor in the United States. So, when do people take this exam and what is the purpose of it?
Okay, that's a very good question. Actually, the time you take the exam, I would say is fairly flexible, but there are a couple of things you must have achieved before you're allowed to register for the exam. For instance, you must have finished your basic sciences. So basic science is the first two, typically the first 2 years of medical school, which you do mostly in the classroom and in the laboratory before you start going to the hospital for the practical aspect of your training. So, for instance, the step one is basically focused on the basic sciences. So you are advised to have completed your 2 years of basic sciences before you register for step one examination. Some schools have their own specific requirement as well. For instance, some school will have you write their own screening exam before they allow you register for the exam as well. But for the USMLE itself, you must definitely complete the 2 years. So after the 2 years of med school, you can register for the exam and take the exam. But there are those that take it after medical school. So they've completed medical school, they've graduated. Some people have already been practicing even for years, and then they come back to register for step one and take the step one examination. So I would say that it's basically flexible when you take it, but generally you must complete the basic science before you register, right? For step one. Yeah.
Mm-hmm. And so, with that, why is this test important? How are the test scores used? And let's talk also about the timing of each of the steps.
Yeah, I would say the test is probably one of the most important exams you write to be able to practice in the US. So you can imagine the pressure students are usually under to do well on the test. So before you get like I would say maybe preliminary license to practice in the US under supervision, you must have written at least USMLE Step 1 and USMLE Step 2 CK. And the idea is to test your basic science knowledge. They want to make sure you have the knowledge to be able to treat patients under supervision. And then the exams are also required for you to get fully board accredited, right, or licensed physician when you become, a fully practicing physician. So it's very, very important. Programs also use it to kind of screen applicants for like what we call residency in the US. So, I mean, if you get for the ones that are scored exams like Step 2 CK, which is currently a scored exam, for those that are applying for competitive specialties, they can use that as a screening method. So they want people with high scores in those exams for them to get into the program. So that's another way the scores are being used currently. In terms of timing to take the exam, I would say that generally most people usually start with step one. That's the most common sequence. Like people go in sequence, step one, step two, and then you do step three in that order. That's what most people do. However, it's not always the case. There are some students rather would take step two first, and you're allowed to do that before you take step one. Because, for instance, if you have somebody who has already finished med school a while back and they've been practicing, they may feel more comfortable answering clinical questions, right? So they will take the step 2 CK, which is more clinically oriented exam. It's testing how you manage patients. So they'll take that first, and then they'll go on and take step 1 after that. But in most cases, people take step 1 first. So if you're in a US medical school, for instance, you take step 1 after your first 2 years of medical school, and then you take step 2 at the end of your clinical rotations, which is at the end of either the third year or the fourth year of med school. Those outside the US, they're also encouraged to follow that pattern. Because if you delay taking step 1, you may start forgetting the basic science principles that you did in the first 2 years. So we also encourage students to take the step 1 after their basic science, even if they're outside the US. Maybe the basic science is 3 years, they should take the step 1 immediately after that before starting their clinical rotations and take step 2 after that. But I would say that we still have a lot of IMGs, that's international graduates, who take the exams even after finishing med school. So the sequence is not really fixed. The timing is not fixed except you're in a US medical school. But for those outside the US, I think it depends on you when you're ready to take the exam.
Yeah, great. And then what is the difference in the content between the three? I think you touched on it a little bit. The first one and the second one's more clinical knowledge, CK,
Yeah.
clinical knowledge, that makes sense. But I'm curious, how does the content break out across the three tests?
Yeah, the content, like you already said or I've mentioned briefly, step 1 is purely basic sciences. So it is testing I would say, the foundations of medicine. So the theories, the principles that you learn in your first 2 years of med school, that's what is being tested. I would say those are almost like physical sciences knowledge, so to speak. But the way they are tested, they're still tested in a way that applies to the patient. So the way the questions are framed, they are what we call clinical scenarios. You're going to be given a picture of a patient who came to the clinic. Most times, maybe has this complaint. They'll give you the physical examination findings, the patient's history, and all that. But the question will now be a basic science question. So you are given a clinical scenario, but it will still be a basic science question about how something works or what is the principle behind this treatment, side effects of such treatment, something like that. So it's purely basic science. But step 2 CK now, you start focusing mostly on management. So there are so many diseases in medicine. So your focus in step 2 CK is to know how to manage those conditions, whether emergently or in the ward, in the hospital, or when a patient comes to visit the physician. So what do you need to do first? What do you need to do second? What do you need to do next? What is critical about patient management. So it's more clinically oriented in terms of just management of patients, how to treat certain conditions, and how to follow up people over time. But then step 3 is more comprehensive. It's the most comprehensive of all the exams, and it's mostly deals with testing how you will practice, right, without supervision, basically, with little or no supervision.
Mhm.
So it's equivalent to you're going to be given scenarios that you're going to see as a primary care physician, right? Maybe in a small practice, for instance. So it's almost as if you have almost 100% clinical decision making capacity at that point. So in terms, you have to know more comprehensive and advanced patient management principles. You have to be able to follow patients over years. So it's not enough for me to just see the patient and treat them. I have to know, okay, will this patient come back in 1 year to see me again? And what do I need to be concerned about when they come back in 1 year or 2 years, right? So it's a little bit more comprehensive and more advanced when you get to step 3. And that is why the examining boards, they encourage students to have at least 1 year of residency training before they take step 3. So what you do in your intern year, the first year in the US when you're practicing under supervision, can prepare you for step 3 because it is more advanced than step 2.
Mhm. Yeah, that's really interesting. Thanks for sharing all of that. And then I think that obviously, this is going to change your approach as you go through school because essentially your first year you're still trying to stay on top of biology and chemistry and things like that, and you're trying to then test out of that basically in the USMLE step 1. And then year 2 you're starting to get your clinical experience, then year 3 you're really starting to get ready for the real job.
Yeah.
But can you tell me a bit about how you're approaching each of these tests and how both what you should be thinking about as you're going into each of these tests and then also when you study for each of them and how you fit the studying into your schedule?
Yeah, that's a very good question, which is a very challenging, I think, topic to address for so many reasons. But I'll start with this. I think one of the first things you have to decide as a student is what path you want to follow. I mean, some
Mm,
are lucky to know exactly where you want to go. Do I want to practice in the US? Do I want to practice in another country, right? Knowing that early, I think is very important. If you can know that even before you enter med school, I think is a plus because then you already have a mindset of what exams I have to start preparing for early on. For some people, they don't hear about the USMLE until maybe they're in med school. Some people don't take it seriously maybe until after the first 2 years, depending on actually for those outside the US. So it might be more difficult for them to kind of start preparing early. But I would say knowing where you are going early is very important. So if you want to go to the US, you have to decide early that, okay, I want to practice in the US for the right reasons. And this is the exam I have to focus on. So I will talk about those that know early and I'll talk about those that don't know early where they want to go. So for those that know early where they want to go, so they've decided early in med school, okay, I'm pursuing the USMLE examinations. I want to practice in the US. Everybody should start by first going to the website of the USMLE examination because I mean it's easier said, but you find out that most of them have not even visited the exam's website. Like you'll be talking to them, they've been preparing for 3 months. And you talk to them, have you checked the website? They'll be like, no. And you have to start with the website because there's
mm,
no better source of information than the website. And on the website, you get a breakdown of each exam. They are going to tell you what the content, the focus of the exam is. There are content outlines, like a syllabus, basically, the topics you have to know, the topics you have to cover, the topics you have that will be tested on the exam. There's also some information about the focus of the exam. Are they focus on the basic science principles? Is it the clinical and the structure of the exam, the timing, things like that. So I think that's the first place to start, to go to the official website of USMLE and read up on the exams, read up on the content outline, download the outline and the syllabus and see if it's in line with what you do in med school currently, or the syllabus is different and you really need to do extra work to get ready. So all those things are going to be very important. So I'll say start there. That's number one. Then number two is I think it's important to talk to somebody who has really gone through the experience before, right? If I'm in a location where I know what I want to do, I have seniors who have gone through the path, they've taken the USMLE or they're already practicing in the US, it will be easy for me to talk to those people and find out their journey. Talk to them about their exams, talk to them about the do's and the don'ts, maybe the mistakes they made early on that you want to avoid, things like that. So I think those first two steps will be very important. Reading about the exam on the website and then talking to those who have gone through the process to answer some questions. So once you have all that down, then I would say start your preparation early. If you're lucky to be taught in school by lecturers who also took the USMLE exam, that is a very big plus. Unfortunately,
mm,
for IMGs, for international graduates, they don't get that luxury in the sense that most of their lecturers have never taken the exam. Some of them don't understand the exam at all. They are probably starting on the same level as you are. So, which means you have to do extra digging personally. You have to find information yourself, but you have to do that early. For instance, when I was in basic science, I got my first aid book for USMLE from the first day of basic science. I bought it as part of my medical school materials. So from the first day of
mm,
medical school, as we are going through topics in class, after I study for my class material, I take some extra time to go through first aid and see how that the topic is covered on the first aid. And so I started using first aid very early, like from the first day of med school. I
mm,
bought the first day of basic science and I used it throughout my basic science. So it kind of helped me to already start preparing for the exam, understanding the exam structure. So I would say start early, get your materials early, buy it together with your medical school books, your first aid book, the recommended material, get it and start going through them little by little. And what you can do is when you can dedicate 1 hour or 2 hours every day to just go through a USMLE dedicated material. So you've covered your school material, you can just spend 1 hour or 2 hours, go through a first aid book, and just see how that content or that topic you did in class is covered in the book. So it gives you early mindset to start preparing for the exam. That's very important. So starting early. And then so once you've been studying for the exam in line with your schoolwork, which is going to be, it can be very challenging, I would say. Other things you can do is, if you cannot dedicate hours during the week for the USMLE, I would say over the weekend, you can dedicate some time over the weekend. So if I focus on the school material during the week, I can dedicate maybe Sundays or Saturdays to just USMLE material only that way. Or I can maximize my holidays, right? I mean, if
Mhm.
we have a 2 weeks holiday, I can maximize. I can spend a whole week just on USMLE preparation and the rest for the remaining week before the next semester starts. But starting early and knowing where you're going early, you'll be able to make the sacrifices you will need to make to be able to start covering the materials slowly. So don't wait till the end. Don't wait till after basic science and it's about 3 weeks to 3 months to your exam or 6 months to your exam. It will be a lot of pressure, but start early,
Mhm.
going through it little by little. And then let's say after a year of doing that consistently, I can now introduce the Q bank to my preparation.
Mhm.
Because I know a lot of the materials now. I've done most of the materials. I can start introducing Q bank. Even if I can do 10 questions every day, believe me, it counts. You just be doing that little by little.
Mhm.
So by the time you're close to your exam and you now have enough time to dedicate solely to the exam, you know that you already covered a lot. You have a lot of foundation. It will now be easier for you to focus on those weak areas and get ready faster for the exam.
Yeah, and that's actually exactly why so many medical students use Anki, right? Which is like a free space repetition platform.
Yeah.
And then Achievable's USMLE Step 1 course also uses space repetition. It's the same idea. You can train yourself to memorize things based on how you're repeatedly studying them over time. And there's just way too much content in the USMLE, especially the step one, for you to study it all and cram it. Like you have to be learning it over time and retaining it over time. So that makes a lot of sense. Other than those things, do you have any advice? I think you already gave a lot of really good advice for how to tackle these exams. But do you have any sort of like other advice that you haven't mentioned yet that you want to make sure that you include?
My advice would probably be directed more towards NGs, just to give some maybe unique perspective as an international graduate myself. One of the things will be the exam can be tough in the sense that it might feel a little bit lonely or a lot lonely because imagine being in a class of maybe 100 and you're the only one preparing for the USMLE. That's usually one of the
Mhm.
NG experience. Unlike maybe US medical schools where you have everybody in second year preparing for the exam, like they have no choice. It's integrated in their syllabus or curriculum. You have everybody preparing for step two, right? But for IMGs, you may have just one person out of 100 preparing for the exam, one out of 50. So it's a little bit more difficult. Or after finishing med school and you don't have a lot of structure anymore, to prepare for the exam can take a lot of effort, combined with work, combined with family, things like that, right? So my advice would
Mhm.
be focus early on, like Tyler said, mentioning the space repetition with flashcards, focus early on evidence-based strategies like approach. Focus early on that. Use what works. I hear people say, okay, I go through a Q bank like 5 times. I've gone through 3 Q banks, maybe 5 times each. I just feel like if you have gone through it once or twice the proper way, you probably don't need to through it again, the third time, the fourth time. So practice evidence-based strategies very, very early. Use flashcards. I hear people say, oh, flashcards is not good for me, or I'm not used to, or I don't enjoy it, but it works. So use it. It's not about how
Mhm.
you feel, right? It's about what works. So use flashcards early. Some people say, oh, doing questions is boring, but doing questions works, right? So you gotta do it. Okay. So I would say don't be afraid to definitely do things that work early. Find out what really works and do it, not just what others are doing or what they are saying. Make sure evidence shows that it works, and that's what you should start doing early to get ready. Yeah, I think that would be one of the biggest advice for preparing for the exam.
Yeah. Thank you so much. This has been Board Certified, hosted by Tyler from Achievable with Immanuel Olarinde, MD. And Achievable has great online courses for the USMLE Step 1, MCAT, PTCE, and PTE, and others. You can try them out for free by going to achievable.me.